The brain is composed of billions of neurons. Very complex, but it's very straightforward because as we develop, the foundation is laid out.
For neurologic diseases, you have a specific organic cause that we can pinpoint to the cause of the disease.
The brain is the most complex part of the human body. It controls nearly every aspect, including our thoughts, our emotions, motor skills, breathing, and so much more. Join us as we learn more about the functions of our brain, the most common neurological disorders, and how we can best maintain our brain health. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk. According to the World Health Organization, it is estimated that 1 in 3 people will develop a neurological disorder at some point in their life, making neurological disorders the leading cause of disability and the second leading cause of death. Now, to tell us more about this, let's welcome Dr. Mark Anthony Santamaria. He's a neurologist and board of governor of the Philippine Neurological Association. We also have with us the Philippine representative for the Asian and Oceanian Association of Neurology, Dr. Jed Noel Ong. Thank you, doctors, for joining us here and sharing this awareness with our viewers with regards to the brain. So many people are familiar with the brain and how it is deemed as the command center ng katawan natin. So napaka-importante yan. So let's give the viewers a little overview on the brain, on how complex yet how simple our brain is. I say simple because all the important functions of the brain are done automatically. Wala tayong kailangan gawin. It does it on its own.
The brain is composed of billions of neurons. So napakadami, very complex. But as you mentioned, it's very straightforward because as we develop from a child to an adult, the foundation is laid out and the brain serves its function for us to be able to live and to have the vital organs functioning in our body as well.
Right, that's very true. Because it's responsible for so many things that keeps us basically alive, it is also very vulnerable. Doc Jed, how vulnerable is our brain to other things from disease, through substances and everything like that? Madali bang pumalya ang brain natin?
Actually, yeah, it's true. We have a lot of neurologic diseases. The brain is very prone to insults, both externally and internally. So we have a lot of diseases, and one of the leading causes actually of morbidity and mortality is a neurologic disease.
What are some of the more common neurological diseases na dito sa Pilipinas na experience mga Filipinos?
The most common neurological disease we all know is stroke. It happens when there's either a problem in the blood flow going to the brain. Either there's a lack of blood flow or there's a rupture of a blood vessel. Another one would be epilepsy. The brain has an electrical activity, and then if that goes wrong, then you get a seizure. And then some of the more common neurodegenerative diseases, meaning as we age, they become more common. Dementia, Alzheimer's, Parkinson's disease, and the like.
So there are so many things that our brain goes through during the course of someone's lifespan, for that matter. Dr. Jed, I'd like to ask you this because maraming nagtatanong din ito. Many are familiar with the term mental health. Is mental health the same as brain health?
Mental health is actually different from brain health because for us neurologists, brain health is more of like an organic. So we usually find an organic cause for the diseases as compared to your mental health. So mental health, it includes mental disabilities like your anxiety, your depression, psychosis, and so forth. While for neurologic diseases, you have a specific organic cause that we can pinpoint to the cause of the disease.
So speaking of those diseases of the brain, pag-usapan natin because I think it's very important for our viewers to understand what can go wrong with the brain. Doc Mark, you mentioned earlier how stroke and epilepsy are prevalent here, especially in the Philippines. Let's talk about stroke a little bit. Bakit ito nangyayari? A lot of people know about it, they hear about it, but what exactly is going on kapag nagka-stroke sa brain?
Stroke is also known as a brain attack, or there's what we call dysfunction of the brain. It usually happens when there's a loss of blood flow. So either may bara, there's a blood clot, or there's a rupture of a blood vessel. So there's a part of the brain that goes into malfunction, and whatever that function of the brain is, you lose it. So we usually get either a one-sided weakness, speech problems, vision loss, or anything, depending on the part of the brain that is affected.
What are some symptoms that may suggest that someone is undergoing a stroke?
So we have an acronym, we call it BFAST, B-E-F-A-S-T. No? B is balance, sudden loss of balance. E is eyes, either you have a vision loss or doubling of vision. F is face, we have an asymmetry, tabingi yung mukha natin. No? We have A, arms, so when you ask the patient to raise their arms, medyo bagsak, hindi gumagalaw yung isa. Then S is speech, no? Yung bulol, hindi makasalita, or difficulty in comprehension. No? And T is time. As you mentioned, time is very important that you get immediate assessment, no? when you get these symptoms.
Doc Jed, another thing also is epilepsy. What exactly is epilepsy?
What happens is that one of the brain cells or the neurons or part of the brain becomes hyperactive or hyperexcitable, then it fires a lot of energy or these synapses in the brain, causing sustained contraction of the muscles because of that hyperactivity of the cell.
So nagkakaroon ng seizures, uncontrolled
Yes.
seizures ang tao. With that, a lot of our viewers may be aware whenever they watch a movie or a program, nakalagay doon, warning, flashing lights may cause seizures. Is this the most common cause of epilepsy?
It can cause epilepsy or seizure, but more common causes, we have your stress, if you have lack of sleep, some others already taking medications for seizure, if they suddenly discontinue or stop the medication, of course, the epilepsy or the seizure would come back immediately.
Kapag nagkaroon ng seizure episode ang isang tao, automatic epileptic na ba siya?
Hindi naman po. Seizure episode is like one attack of that event. And an epilepsy is a diagnosis wherein the patient would have multiple attacks of seizure episode.
There's still so much more about the brain that we have to share with our viewers, especially awareness on what can go wrong. And that's what we'll be talking about when Med Talk Health Talk returns. What are the other common neurological disorders or diseases? And most of all, how can you best promote brain health? So stay with us here on Med Talk Health Talk. We've been talking about neurological disorders, and it's vital to spot warning signs so you can treat them right away. Now let's welcome back neurologists Dr. Mark Anthony Santamaria and Dr. Jed Noel Ong. Now continue our discussion with neurological disorders, diseases. Doc Mark, let's talk about headaches, maybe even numbness. Can these be signs of a neurological disorder?
Definitely, it's a neurological symptom. No? We always neglect these very common headaches na itulog mo na lang, no? Numbness and everything. But a headache can be very simple, but it can also be a sign that there's something more sinister, something happening. You have pain-sensitive structures in the brain, and that can give you the headaches depending on what causes it. No? Numbness, on the other hand, it's a nerve problem. So the nerves are also part of the nervous system. And if you have malfunctions of these nerves, no, let's say naiipit, impingement, or inflammation, or what, when you get pain, numbness, ito yung common na pins and needles sensation, tumutusok-tusok, no?
Or nagmamanhid.
Nagmamanhid, yes. Or these are signs that you might need to see a neurologist for that.
We know our brain is also responsible for our movement as well. So I'd like to talk to you, Jed, about some movement disorders. Not all movement disorders, but the most common ones here in the Philippines.
Basically, movement disorder is also part of the diseases that neurologists see. So, number one, of course, is Parkinson's disease. We often see patients or old patients having like tremors, stiffness, very slow movements, and imbalance. So, it's a common neurologic disorder as well in the Philippines. And one other movement disorder that it's specifically for Filipinos is X-linked dystonia, Parkinsonism of Panay, or the lubag. It's only for Filipino men.
Okay. Ano mga symptoms nito, Dr. Jed?
For X-linked dystonia, Parkinsonism, or lubag, usually the patient would present with dystonia or involuntary movement of either the extremities, the neck. Then it will progress into Parkinsonian symptoms like slowness of movement, tremors as well, in the latter part of the disease. And usually, we see this on patients around late 30s, early 40s, mga middle-aged men. And most of them would hail in the Panay Island.
Now, this is the part of the show, one of my favorite parts, because we get to answer questions na galing sa ating mga viewers. So we have a question here.
May epekto po ba sa bata kapag binabasahan ng libro kahit hindi na naiintindihan?
Doc Mark, do you have something to say about that?
Actually, it goes both ways. Number one, the one who reads will have a mental stimulation. And then yung bata na binabasahan, eventually he will learn. Remember, the child, the brain is developing. So the more you expose it to any mental stimulation or training, no, they get better. So in the long run, be helpful for both.
Magandang explanation yan, Doc Mark. Now we have another question here. I'll address this to Doc Jed.
Namumukhaan ko yung isang tao, pero di ko matandaan pangalan niya. Sign na po ba yun na makakalimutin na ako?
Yeah, actually pwede, no? Pwede siya maging sign ng pagiging makalimutin. There are different symptoms for dementia. It's not just like memory loss. Actually, this description is not part of the memory loss. It's another symptom that neurologists often encounter. It's not just in dementia per se, but also in other neurologic diseases. Kasi if one part of the brain is affected and that certain part of the brain is functioning then that's the time that symptom would be present on that patient.
It can be a sign, but sometimes it can be just a normal occurrence once or twice. Pero pag madalas na ito, it could be a symptom of something probably more serious. We have another question here.
Paano nakakatalino ang paglalaro ng puzzle games?
So yung mga puzzle games like Sudoku, then crossword puzzles, it can really help, especially if someone is developing like memory problems already, cognitive decline. So important then, like it's a brain exercise.
Okay.
So it's really advisable for patients to do that. But for the slowing down of the degeneration, so this is one of the problems with neurodegenerative diseases. No? So we really don't have treatments for this disease. Except I think for Alzheimer's, they already developed certain medications that would try to slow down the progression but not halt it. So hindi siya hihinto talaga.
We have another question here.
Doc, mas gumagana po ba ang utak kapag under pressure?
My analogy for that is, for example, you have a team and you have a deadline. So all of your members of a team work. No? So in the brain, a majority of the neurons will work and will fire kasi you're under pressure, under stress. So for you to achieve that task. No? But you should balance it. After that task, you should have adequate rest as well. It's very important. But yes, that's true.
You bring up a good point. So rest, that's where the recovery comes in and things. So hindi pwedeng palaging under pressure ang brain natin. Okay, very nice. And here we have our last question.
Doc, nagka-dementia po ang lolo ko. Ibig sabihin ba nun magkaka-dementia din po ba ako pagtanda?
With dementia, Alzheimer's disease yung number one common, no? But there are other types of dementia. And for Alzheimer's disease, partly there's genetic cause. So yung patient, kapag merong mga relatives, mas mataas yung risk factors to develop it. But it doesn't mean na automatic magkakaroon siya ng dementia.
So very nice questions. Please keep those questions coming in so we can ask them on future shows. So it's never too late to prioritize your brain health. More on this when we return. So keep it here on Med Talk, Health Talk. There are many lifestyle changes that we can do that can affect our brain health for the better. Now, to tell us more about this, let's welcome back neurologist Dr. Mark Anthony Santamaria and Dr. Jed Noel Ong. For this portion, let's talk about some important things when it comes to brain health, because just recently, we celebrated World Brain Day. The push of this is more awareness para sa mga tao with regards to brain health. What was achieved? What is the ultimate goal?
World Brain Day, this was started by the World Federation of Neurology. So it's a worldwide event. It's every July 22, and the Philippines is part of that. So it's actually an awareness campaign for brain health because we want to make sure that each and every Filipino, they have knowledge, they have education about what brain health is, what brain diseases are, and who to consult. So as I mentioned earlier, brain diseases are very preventable, but to prevent, they have to know. So they have to have education as to what the signs and symptoms are, plus they have to have access as to who they can consult if in case they develop these symptoms.
So those are very important points. So education, awareness, especially access to the correct person to go to with regards to that. Meron bang ginagawa ang mga Filipinos na probably hindi sila so much aware that affects our brain health? It's something that they do in their everyday.
Actually, marami talaga silang ginagawa. No? Especially, most of the Filipinos would not consult doctors, not just neurologists but doctors. They tend to self-medicate, especially kung pag simple headache lang, they would come into our clinics with like months history of headache na. Tapos with regards to stroke, of course, it's an emergency, but then we would see them 2 days after, 3 days after, kasi they would go like, baka sa BP lang yan. They would take their medication kahit hindi naman dapat na iniinom kagad lang yung medication. And of course, yung mga ginagawa even before, like if merong epilepsy or seizure yung pasyente, they would place spoon sa bibig, which is hindi dapat gagawin.
And this is what Brain Day tries to change, the awareness, that education, that is very important, especially with things that affect the brain. So what else can people expect with activities that coincide with the Brain Day celebration?
Here in the Philippines, we have the Philippine Neurological Association. So it's the governing body for all neurologists. This November, we will have a Neurology Week, wherein we will have a lot of lay forum, lay fora about the basics of stroke. No? And what we do now, there's what we call neurology to the periphery. For us neurologists, we even go to the far areas of the country and islands, no? So that those who are not able to be aware, because of problems in communication and everything, we go to them. Those are the things that we advocate. There's also what we call teleneurology. That's one of our projects. That's the beauty of technology now. Because of teleneurology, even if we're separated into different islands, we can communicate, we can reach people who are in those areas and actually discuss and maybe consult and maybe offer some treatment.
That's a good combination of the old and the new, the old style of physicians going out to people for good access, and the new, maximizing technology for that information for a lot of people. Now, Dr. Mark, what are some lifestyle changes that people can take, our viewers can do in order to keep our brain healthy?
It's very simple. No? Brain health is like the other organ systems. You have to make sure you have a healthy diet. Definitely, you have to avoid fatty, processed, very salty food, very high in sugar content. Fruits, vegetables, whole grains, very important. Fluids, you have to be very adequate in terms of the water intake. And then you have to avoid alcohol intake. And then smoking is also one. And then there are some recreational drugs that might actually cause problems in the brain that we have to avoid as well.
Very nice. So to wrap things up, I'll start with Dr. Jed. What advice, what tips can you give our viewers, the Filipinos, especially when it comes to their brain health?
Number one is lifestyle modification. So most of the diseases, especially the stroke and epilepsy and headaches and so forth, can be prevented with lifestyle modification. Important thing is that yung diet. So a lot of Filipinos are obsessed with fast food. So those are the things that should be lessened. And exercise as well. Because we Filipinos usually go and exercise sa gym lang. But the normal individual just go to work, then go back home and sleep. So yan yung mga nakakalimutan. So lifestyle modification is very important. Then if you have like a certain disease or if you feel something, huwag nang patatagalin. They might need to go to the hospital because it might be something serious. So yun yung pinaka-important.
And of course, Dr. Mark, what advice can you give our viewers, especially when it comes to education? A lot of people think, basta sa katawan ko, doktor na yung bahala. I don't want to bother myself about knowing about those things. What kind of tips can you give, or how important is it that we know something about our body?
As mentioned by Dr. Jed, so good diet, exercise, lifestyle. So there are a lot of educational information online, on social media and everything, but there are also a lot of fake news. So it's best to go to the official site or the official source. We have a website, the Philippine Neurological Association.com, where all the correct or the information about brain diseases can be found. Plus, there are a list of neurologists that might be near your area posted in that website. So you can actually consult immediately and have proper care and treatment.
Very important information there. And I'd like to thank you both, Dr. Mark Anthony Santamaria, Dr. Jed Ong, for joining us on MedTalk Health Talk, sharing your wealth of information to our viewers with regards to brain health. Thank you so much. Here in the program, we always emphasize how mindful eating, getting enough sleep, and exercising regularly can keep you fit and healthy. These lifestyle changes not only help improve your body, they help improve your brain health as well. I'm Dr. Freddy Gomez, and thank you for joining us here on MedTalk Health Talk.